Tomorrow, we don't expect there to be normal outpatient services at Gertrude's Hospital. All our doctors will not be working. And to that effect, we are calling upon the public to take the children to other institutions. We don't expect a single child to be affected because all the other institutions in the country will be working. Only Gertrude's Hospital and the satellite clinics will not be working. So we expect that services will in fact be disrupted, but those who will need services will be able to go to other institutions and receive services there. Well, we can only represent people who we already have, but also our intention is not to inconvenience the public. That is why it has to be one institution at a time, and depends on where we are in the labor relations, how far we have gone in terms of membership, how far we've gone in terms of discussions and agreements. Now it's clear, one, Gertrude is the worst employer, so that's why Gertrude's first. Secondly, all our doctors in Gertrude are members of the union. They need to be represented. Look, this is not a question of terms of service. It's a question of recognition. If you're having so much disagreement over the question of recognition, which is in the law, they have to sign it. The conciliator's report said that they should sign the recognition agreement, and they've simply said no. You really can't see for yourself who is fighting who. And I know the reason why they haven't signed it. The private hospitals have in fact come together in an association that they're trying to create, and the intention is to kill the union and perhaps see as few doctors as possible. In fact, all doctors who are members of the union received threatening letters from Gertrude's telling them to not take part in any kind of activity related to the union. We'll wait and see if it's possible to prevent the constitution from taking effect by threats or by any other means. Now, Gertrude has a responsibility. We gave a 12-day strike notice. 12 days is 5 more than the recommended. We had a conciliatory process. We have been waiting almost 6 months. We had a meeting this morning for a couple of hours. They just will not sign recognition agreement, and so pretty much that's it.
Malalamishi zinaweza kuwa kwa any group of employees, lakini tuko na systems na process za collect that information, and even our policies kwa institution are very open. Employees are actually allowed to escalate na kuongea juu ya issues zao zile zinawa affect kwa kazi. I can confirm to you that our systems and processes work, and that is why we are actually where we are as an institution, and we are able to attract and retain our employees as such. Yes.